All right, thank you so much. The program still this morning on ITV on independent television, and I told you that we are going to be looking at the COVID-19 situation one more time in the country and also in Nigeria. Well, it's still on, the fight is on, but this time we are emphasizing more on the vaccination exercise that is going on throughout the country in various LGAs across the country, and Edo State is not left aside because we understand that the vaccination has been flagged off about some few days ago at various LGAs in the state. And as it stands now, just about yesterday, we got to know that a total number of 124,000 Nigerians have been vaccinated so far in the country. So it shows that we are on the progressive move as we fight against COVID-19. Well, to look at the technicalities that may be involved concerning the vaccination this morning, we are so privileged to have Dr. Pius Ononigwe. He's an epidemiologist with the African Center for Disease Control, representing African Center for Disease Control in Edo State. Sir, you're welcome to this program this morning on ITV. You're welcome.
Thank you very much. It's a pleasure to be here this morning.
All right. Now, when we talk about technical support, as it relates to the COVID-19 vaccination, exactly what are we talking about?
Okay. When we talk about technical support, as it relates to COVID-19, like you have mentioned, we are talking about strengthening the health systems. Like the partners have always been on ground to strengthen the response that we have been having across the federal, state, and local government levels. Like in Edo State, for example, we have a lot of partners supporting the Africa CDC, the NCDC, the WHO, and other, even Red Cross and some other partners. They work together to make sure that at each stage of the response in the public health interventions we are having, we are actually achieving our goals. And you recall that the last time I came, I spoke about the peculiarity of Edo State, whereby the structure is obviously very strong. It's just that we are trying to make sure that we galvanize it to ensure that the response is very, very good. In terms of making sure that we are taking decisions by virtue of understanding the evidence from the data we have generated, interpreting it correctly, and also using it to direct policy making. And it has to do with from the grassroots, where these data are being collected, how they are processed, collated, analyzed, and used to inform policy making. And that's exactly what is happening here. And that is why we are not surprised that we have actually done so well in terms of trying to contain the COVID-19 in the state, and even presently with the vaccination rollout that we have been carrying out for the past 5 days. So the technical support, in summary, ensures that there is a very strong collaboration, communication, cooperation with the states to ensure that because all of us have the same goal, to improve the quality of whatever we are doing, if it's in terms of response. So we're working together to make sure that these things are actually actualized.
Okay. Now, looking at the kind of technical support we are talking about now, do you think those that are receiving the vaccines now, do they have a role to play in the support that we're talking about?
Okay. The recipients of the vaccines actually are enjoying the outcome of quality collaboration, cooperation that we see when people come together. Because when you say technical support, somebody is already doing something good, but you are using the experience you have gathered all over to ensure that everybody, what we are doing is actually giving the desired result. So I think the recipients, those that receive the vaccines, they are not part of the technical support, but they are enjoying the benefits of a system that is being strengthened, a system that people are really working together to ensure that these things are working well. Just like I said, this support is coming. We have even the governance level, where the governor and also some of his team members are also giving their own technical support, because technical support is not only public health wise, also policy making. Somebody says, okay, this thing you are doing, I'm prioritizing this because you have given me this evidence. Let me prioritize this, you know. So, and use his governance experience to collaborate with the technical input made, and then the response gets more quality. So the recipients may not play a role, but they are enjoying the benefits of a coordinated response.
Okay. Now, well, the vaccination now, well, it's still in the States, but as it stands now, we're looking at it at the LGA levels across the state. Now, I don't know whether it bothers you guys at the African Center for Disease Control. I mean, you are a rep in Edo State here.
Yes.
There seems to be a nonchalant attitude, you know, coming from the supposed recipients of these vaccines. I mean, we're told that in the first phase that frontline health workers are supposed to be the beneficiaries. But as it stands now, there are indications that these frontline health workers are not really interested. I don't know what to make of this. Okay,
actually, we have been very proactive, because this issue of hesitancy or people's apathy towards receiving the vaccine. If you recall, when the COVID-19 pandemic started, conspiracy theories have actually erupted. There are countless conspiracy theories, but we have always used this approach of rumor investigation, rumor management, and also collecting data on people's perception and using it to inform the interventions we are giving. Take, for example, we knew that vaccine hesitancy was going to be a problem, because that is even what's obtainable in the other parts of the world. So we had to make robust our risk communication strategies, such that at the grassroots level we have the people who communicate to the community members in the language they will understand. We have a lot of them at all the LGAs, all the wards, the town announcers, the community mobilizers, the risk communicators. They keep on engaging the people on even testing. We had issues with testing. This engagement was made at the grassroots level, and we started getting improvements. We also saw that with people, when they are confirmed positive, they don't want to receive care because they don't believe. We use this method too. So we are leveraging on what we have gained in this state in our risk communication and community engagement to also improve demand creation for COVID-19 vaccination. And if you recall, this phase 1 is targeting supposedly 1% of the population. So in that 1%, we are having the healthcare workers, the frontliners, the frontline non-healthcare workers. That is the people who, by virtue of their activities, they keep on receiving troops of individuals that could expose them to risk. Just like as a journalist, you are a frontline worker, because people come, people go. People in the airport, military, paramilitary, and so many of them, by virtue of their job, the essential duty they are giving to the community, they have a lot of people they come in contact with. So those are and also the strategic leaders. The strategic leaders who are also important, because they are a very few part of the community, and also their participation will help to give credence or increase acceptance. So these are the 1% that we are supposedly targeting now. And just like you said, we are having hesitancy, and we knew hesitancy would come, and we conducted some local studies to understand the hesitancy within our system. We found out that there was almost 60% hesitancy among healthcare workers, and we found out the reason. And the reasons were not far from some of these conspiracy theories that are not founded on science. So we started to release jingles, release this information that help to clear some of these misconceptions by using evidence and science. And we said that, and now what we are doing is also, because if you check, we have done about 10,000. We have a target of 46,000.
Yeah, Dr. Pius. Now, what I'm trying to look at is the fact that there's no doubt that the frontline health workers, they're supposed to be among those that are even supposed to further enlighten the people about the benefits of getting the vaccines and all that. But what we find now is that these frontline health workers are not showing a positive attitude towards the vaccination. There seems to be a kind of an attitude, a drawback attitude for the vaccination. What do you think is responsible for that? Take, for example, a doctor that has been trained, he understands what we're talking about. Then for him to come out and get vaccinated, he doesn't show any interest. What do you think is responsible?
Yeah, actually, it's because of these rumors, misinformation.
Even with the education and the enlightenment?
Yes, when trust sometimes have to do with when people believe that the morality of a system is no longer trusted. Take, for example, myself, I understand the truth. I knew that this conspiracy theory do not have any scientific backing, and that is exactly what we are doing. Although, like me, I'm vaccinated and I have my card, I always use it as an emblem to show them we know the truth. If these things were true, as people are portraying them, some of us will not actually, because we have the information. And if there was anything wrong with the system or with all these things, we will not draw back. So some of us have started getting immunized to show them. It's not necessarily hesitancy. We don't have problem with hesitancy. It's just that some people are not sure if these things that they are saying, myths and legends, stories of what may or may not be true. But the point is this, sir. We understand that. We knew it on time, and we have started engaging. Like presently, we have begun to, for EDO, it's worse, it could be worse in other states, but we understood it earlier and we identified it as a possible challenge because we saw the pulse around the country and even globally. So what we have been doing, because if you check the data, the uptake from day 1, day 2, day 3, day 4, we're in day 5 going to day 6, you see that we are having almost like 100% increase from day 1 to day 2. You see that? So it means that we are really succeeding. And how are we succeeding? We are engaging all these healthcare workers because we know hesitancy, I don't have problem. Hesitancy is different from not able to take. We are people that have made up their mind. But most of these health workers fall into the hesitant group. And we know that hesitancy can be addressed. And how can it be addressed? I have taken. When I was taking, I know so many of my colleagues that looked up to me and that's how they are passing the message. So that is what we are doing. We are now leading by example, engaging them, dispelling those rumors and communicating with them. And if you look at our data, you see that each day we are getting almost double response from the people we are targeting. And we're also going to those areas because there are a lot of primary health care centers across the state. So we have our team. In fact, we have special teams other than what we should have had in the state, because I told you that we always try to go a step ahead. We have special teams that will be reaching out to these primary healthcare centers, health facilities, and we have social mobilizers and risk communicators that will go before the time the team will arrive. Maybe they will arrive tomorrow, they will go today, and engage them. What are their fears? They will use science to make explanations.
The reason why I asked that question is that there are, some thoughts from some angles that we probably did not need the vaccination or the vaccines after all, because the proponents of these thoughts are of the opinion that after all we started getting very positive results in the area of the treatment, because the data you talked about earlier on, in any COVID-19 data, you get to see those affected, those discharged, and those treatments. And the data that the NCDC released over time show that very progressive number of Nigerians were really getting treatment. In other words, it showed that Nigeria as a nation was high in the treatment of the COVID-19, the virus. Now the question is, if we had that, do you think we needed the vaccination after all? Because for these people, they are looking at it that, okay, since we were getting treated, we didn't need the vaccination. We don't need the vaccination. Don't you think that is responsible for the nonchalant attitude that we seem to be getting, even among those that are supposed to be helping to inform people more about it?
So exactly the point you made, we have also looked at it and we have used it as a driving force. Number one, most of them are saying that, and just like I said earlier, it's because people don't have information. COVID-19 is a public health emergency of international concern. You could see what some of these Westerners are doing to ramp up vaccination and to make sure everybody, because if the Europe and the Americas and some parts of Asia work hard and bring the transmission and put COVID-19 under serious containment or reduce the incidence, people from Nigeria will be traveling. See the way we travel. See how the world is very connected. And someone comes in and brings the COVID-19 to another country, and the country starts from square one. So whenever a disease is a public health emergency of international concern, or whenever it's a pandemic, every case anywhere is equivalent to cases everywhere.
Yeah, I know.
So that's the point.
Yeah, Dr. Pius, what we're saying is that we had a situation whereby we started having treatments. Is that correct?
Yes.
For the COVID-19.
Yes.
Now, why don't you think that we would have just concentrated more on the treatment rather than the vaccination?
You cannot use when you have a problem, you don't want to be managing that problem. You go to the roots. We have evidence that vaccines, just like polio, just like measles, just like rubella, just like yellow fever, you have evidence that vaccine is the only tool, the safest and even the cheapest tool to nip a disease, an infectious disease.
The vaccination now, is it a cure for COVID-19? Does it cure COVID-19?
No, it prevents those things that you want us to be using drugs. It prevents death. It prevents severe condition with the attendant pathological effect on the body afterwards. It even prevents disruption of the economy, because once the people are not, the cases are not high, the system will feel that business could be going on. So if it prevents death, prevents illness or severe condition, then why are we not using that as an option? Why would we want an option where people will get sick, we treat them and they die? It's not, I think it's suicidal if we have a better means of preventing it. Then another thing I want you to get clearly is, we don't want this virus to be replicating, because we are getting a lot of variants of concern. And if viruses have a very safe haven without interruption to replicate, chances are there that we'll be creating variants that we may not even be able to handle. So the earlier people get vaccinated, the better for us, because...
So the vaccination that is going on now in across the LGAs, which of the variants of the coronavirus does it really get vaccinated on?
Most of the vaccines that are in circulation, with the data and the evidence we have, can handle the variants that have been identified.
Okay, which are?
We have the UK variant.
That's the B117.
Yes, we have that of the South Africa. So there is also evidence that the Brazilian variant could also be, and there are other variants that have not been identified, because it's through genomic sequencing you're able to identify these variants. And we know it's possible that there are some of them, especially in some of these low and middle income countries, where we do not have that capacity.
So the vaccine is a holistic, item against all the COVID-19 itself.
Yeah, it has been a standard. Vaccination has been the tool. Polio was this. You talk about rabies, almost measles. That's the only way, because you administer something that gives the body the capacity to fight it when it comes. You don't need drugs. Drugs have a lot of effects. You have to, they pass through the liver. The liver has to detoxify. The organs are put in danger when you keep on taking drugs. Okay.
Now, a while ago, let me say that because of the Chroma system, the viewers out there may not have to see it because of the Chroma. So I have the card so that I'll just let the viewers out there know how it looks like. Because at the end of the day, when you get vaccinated, you won't get this card. It becomes your property.
Yes.
Now, you have COVID-19 vaccine. It's safe and effective. Then it's from the Federal Ministry of Health, National Primary Healthcare Development Agency, COVID-19 vaccination card, Part 1, basic information. You are going to have your states in it, your LGA. So for Dr. Pius, he got vaccinated at EDO. That's correct, Ward 7.
Yes.
And New Benin, that's the statement, that's the area precisely.
Yes.
Then the head facility, it was at New Benin head facility.
Yes.
Then the name of the vaccinator is also written here. If you don't mind, is there you are M. Or Kongai vaccinated you. That's what you have here. Then behind it, you have the name of the vaccine, which is boldly written here as AstraZeneca Oxford COVID-19.
Yes.
And of course, the dates, the date is going to expire. Now you have on the 9th of, I don't understand this date now, on the 9th of 3rd, 2021, what does that mean?
The 9th of...
the 9th of March 2021, that's the expiration date, that's what you have here. Then you also have dates given, which is on the 23rd.
Okay.
Then you have the next appointment date, which is on the 21st of June 2021. So this 9th of March 2021 expiration date, I don't understand it.
Okay. I don't think maybe if you check what is captured there, because what we are supposed to have there is the date when you were administered the vaccine and the date when you are supposed to come and take your second dose.
Okay.
So
okay. The day you next appointment. Well, the way they wrote it here, they wrote the expiration date first, then the date given, and the next appointment was on the 21st. On the 21st. Today is 24th. So
yes.
When was the first time you took it?
I took it yesterday.
Which was 22nd.
22nd.
Okay. So your next appointment is going to be when?
My next appointment is going to be we are looking at making it 12 weeks.
Okay.
That's 3 months from now.
Okay.
Because we found out that the more you say, the better or the higher the body has the capacity to produce immunity that would be able to hinder severe conditions.
So in other words, it's advisable that you keep your appointment intact.
Yes.
Okay.
Yes.
Now, it was signed by the head officer, Izehiwa M. Okonrai, and signed. Now we are doing this morning so that viewers out there will know, and it has a seal. The card has a seal.
Yes, that's the most,
which makes it authentic. So
yes,
you cannot fake it.
It's already scanned. There is a code.
Okay.
There's a code that is already with the National Primary Healthcare.
Okay.
So even if you travel out and some people may want to say they are vaccinated and take this card. When they go out, they would have a code. You can see the batch number there. I don't know if you saw the batch number.
Yeah.
Inside.
I think let's see now. Okay, inside is seal.
Yeah, no, not inside. If you turn it, the batch number is written up left.
Up left.
Yeah.
We don't have the batch number.
Yes. Okay, if you turn it.
You can read it out so that viewers out there, so that they get to.
So the batch number is.
Just
here.
put it down. Viewers
okay.
They won't say because of the chroma.
So it's 41212005. So that batch number is peculiar. It will be because it will actually show that this batch. I got this vaccine from it, and assuming I go to the airport and they are questioning, they have seen the code, and they still want to find out more. They could quickly put the batch number and access. By the time they do that, they will find out that such batch was shipped to Nigeria.
And if something even happens to,
you can trace it
to that person, they can trace it with
the batch. Yeah, okay. There is what we call traceability. It's part of these measures because it is an organized system. We'll say, okay, this batch. People that someone has taken this and this is happening, we find out other people that are within that batch if anything happened. So that could also help us to narrow and be precise in whatsoever finding we want to do. Okay. And also it could be used to find out if really someone has taken that vaccine, because the batch will also be traced to the country.
Okay.
Yeah.
Okay. All right. Now let's look at the technical facilities on ground in Edo State. That's where you are working now. What are the facilities on ground? Are they encouraging? Are those facilities technically meant to support the vaccination exercise in the state?
Yes, because the technical, when you're saying technical facilities, we are saying what are the things for each of the stage. We have the transportation.
Okay.
We have the storage. We have the deployment.
Okay, we've passed transportation. Okay, we can't still talk about the transportation.
The transportation,
because you have to take the vaccine.
Yes,
okay.
The vaccine was well delivered in good condition, and we maintain. Remember, if the cold chain is broken, it's as good as we are doing nothing.
What do you mean by the cold chain?
The cold chain is the vaccine is supposed to be stored within 2 to 8 degrees Celsius. So if we begin to because we always track the temperature of the storage facilities, we have a monitoring chart, temperature monitoring chart, to find out if we are within 2 to 8 at every point in time. So we also even do that to the point of the people vaccinating. We have supervisors that go around randomly to check. Let's see, they use the temperature monitor or the thermometer to check if the environment where these things are stored, even to the point of delivery, is within that temperature range.
Okay.
So those are part of the things. And we also have reports. And when we see a signal that this LGA is not, the temperature is not, we begin to ask, do something. What of your ice pack? Because we want to make sure that all the vaccines we administer in EDO
are intact.
So that people, there will be seroconversion. Seroconversion is that by the time they take your sample, they check, they will see that your immunity for COVID-19 has gotten up. And that can happen if the temperature is well maintained. Then we're also talking about, we are trying to make sure that the 1%, the target population, we get them within this period. So we are doing a lot of things because the governor set up a technical committee on vaccination. We have our COVID-19 response technical committee, but because of the preference and the need to make sure we do the best, we do the best in this. We'll have a technical committee. We review each of these indicators every day. Wherever we are seeing any one that is going contrary to expectation, because we have benchmark for each of them, we begin to raise alarm. Okay. We can deploy people there. We can tell our team, focus on.
Have you had any cause to raise alarm as it pertains to Edo State?
Yeah, at this point, because we are closely monitoring, we have not raised more much. The area we raised alarm earlier, which we are trying to block, is to increase uptake. And we are having massive engagement of all the various healthcare workers organizations, even at the local level, the state level, and individual level. So institutional level also. So we have been actually working to make sure that this demand for this vaccination is high. And I've told you, if you check our 5 days of operation, every day you see that we are moving from, maybe if we had 10 today or 100 today, we're having 200, showing that, but we are not resting. We want to make sure that by the time we finish, at least that 1%, and we don't want the 99% to come first. We want the health workers to be well immunized, because they are the frontline people and also the other essential workers.
Beautiful. Now, let's talk about the vaccinators now, because the vaccinators are part of some of the technicalities that we also begin to look at as it relates to the vaccination. Now, there are so many videos, funny videos about how people get vaccinated and all that. Now, where exactly does the vaccinator, where does he or she gives you the vaccine? I saw one funny video, a certain man, pumped the syringe back at his bottom and all that. Where exactly did they give the vaccine?
Okay, I think that video maybe is part of the conspiracy theory we are talking about, because it's a very simple practice. I want to be clear. We have been doing a lot of vaccination in Nigeria, so it's something that Nigeria has as an advantage. Remember, last year we were certified polio free. So, and it took a lot of rounds, open campaigns. But it's just like you asked, is the deltoid muscle, the upper left arm.
Of your left,
yes,
not the right.
Not the right, left arm. And it's IM is in the muscle.
Okay.
And I think it's 0.5 mil.
Okay.
Yes, so they know it. It's not, what we need to make sure is that
that's 0.5 mil for one person. So if, for example, a vaccinator wants to vaccinate me, he gives me 0.10 mil, I can reject it.
Of course, you can. It's supposed to even be communicating with you, make you understand what you are taking. This thing, it should even tell you that when you get injected, you have normal slight pain, which is common with something entering the body. It has to give you something that communicate with you.
The number of mil, is it age specific? Does it have anything to do with your age? Maybe I'm 70.
No, this one we are doing is 18 years and above.
Okay.
They are doing a lot of studies now on less than 18. So that is where we are beginning to consider those. But the trials are still ongoing. So probably by the time it's concluded for ages less than 18, then we may begin to talk about age those adjustments. But for now, it's 0.5.
Okay, 0.5 milligram from 18 years and above. Okay, now you talked about people manifesting different behavior when they're about to be vaccinated. There was a funny video that went viral of one certain senator, one lawmaker that started behaving funny as he was about to be vaccinated. So, for your vaccinators that you have around the Edo State, are they well trained on how to talk people, calm people down when they're about to take the vaccine?
Yes, they had a 2-day comprehensive training. In fact, they were invited and they were kept in a very good environment, and they were trained for 2 days. The state team were on ground, the National Primary Healthcare they were on ground. Partners, WHO, Africa CDC, NCDC, all of us were on ground, and we developed a schedule in line with the national primary health care. So they were well trained, and also we did practical session. And not only that, we're also monitoring them. Just like I told you, we try to go an extra mile here, which because we have a political will of the government who is part of the team, like the vaccine technical committee, the technical committee for vaccine in EDO is headed by the deputy governor. So we sit with him almost on a daily basis. There's no 5 days, 7 days we don't meet up to 5 days. In fact, his office has been practically converted to our meeting, our secretariat, where we meet to review strategy. And we also have calling room in the agency, in the state primary healthcare agency, where we review activities every day, and LGA by LGA, because we have about 103 vaccination points, and now we just created more. More is to, because we are seeing that some of the municipal, the Oredo, the EGO, the demand is increasing, and we don't want to be so conservative. We have to we trained them yesterday, and we also deployed them so that they can help to go up. We have created demand, and people are now saying they want it. So we had to push them to.
Now, from your assessment, how would you want to rate the level of success as relates to those that are supposed to be vaccinated on the first phase in these LGAs?
Yes, actually, this is the 5th day. This is the 5th day. Some people, this is their 5th day, some their 6th. And we are still, we have 10 days, about 4 days to go. Although we are envisaging a situation where we may have to do more pop. We are still communicating with the National Primary Healthcare Development Agency of that. Obviously, the space is not exactly what we expected, but we knew that. Or in fact, if I want to say, it's not exactly what it should be, although it's not far from expectation. But we are working against all this resistance to make sure that we are still there on time. So obviously, what we are seeing is not what it should be. If people, or if these conspiracy theories were not there, that are not founded on science. But remember, we're still going to do another round, another phase that will involve up to, we are targeting, remember this one is targeting about 3.9 million Nigerians, barely 1%. We are still targeting the second phase that will be up to, say, 20 million people. So this is just like a pilot study. We are learning the lessons, we're improving on that, and we're believing that by the time we get to the second phase of this campaign, we would have been able to address all these things. And these health workers are going to be the drivers, the strategic leaders. By that time, people have taken their time to make up their minds. And because if I take, there's no way so many people would want to take, because they have seen that this person is sound, even better off. So by the time we get to the second phase and the third phase, I think this will be a thing of the past. Remember, this is the first, almost like a pilot study. And even at that, I cannot say that we're not doing so well.
Okay. Now, I don't know, there are allegations that, recently the U.S. came out and said that the AstraZeneca is 79% effective against the COVID-19. But again, there are reports that it seems that the study that was carried out was from an outdated data, collection in the U.S. I think I saw that popped up a while ago on my system here. I don't know what was your immediate reaction to this.
Okay, I think the reports we are still working on is the data released a few days ago about the efficacy. Remember the European Medicine, the European EMA, the European Medicine Association or Agency that tried to regulate the use of drugs in Europe, actually say that they are going to be the drug, the vaccine,
certify that
yes. So that was why France, Germany, Spain, Italy had to commence, which even the France president demonstrated by having his own jab. So, and also WHO had also said the same thing. So what the data that was published concerning its efficacy in the US is also an addition to further collaborate the safety of the vaccine.
But now,
the reports that you said that was raised, using outdated data.
From an outdated data.
Yes, it's a personal opinion that I think has not been. Let's see what the European Medicine Agency or Association will say about that. But for now, we have this data. How we work here is, if we have a data and we show it, and you have any data conflicting, let us see it. Not maybe it appeared to. So I also read it the way you read. But you remember that because we are driven by science, we always act if we see evidence.
Yeah, Dr. Pius, you know, the way the world is with US, US, I don't know, unfortunately enough, it seems to be that a lot of people, they will finally believe when something comes from the US. Yeah. I mean, for somebody like, Fauci, the head of the science, investigation team in the US, saying that the trial was from an outdated data. That's the latest concerning that now. I don't know how you want to react to that.
Oh, okay.
Because the US findings further gave a kind of confidence to the world on the AstraZeneca COVID-19 vaccine. So for this same US to now be saying that the trial was from an outdated data, don't you think that would complicate the issues?
Of course, it has been, and even the Johnson & Johnson that some people are saying is better in Nigeria, some people are saying they may not want to take it in the US, and they would rather take the Pfizer. So this issue of product affinity or choice has been there. So, but that of the report given by Dr. Fauci, as you said, to me, you will see after some days the regulatory agencies will come up again to say something. So I think it's better because if I say Dr. Fauci, who is renowned, is right, I stand is wrong. I stand with the EMA or the WHO. We are going to, everybody will come to the drawing board. Let us see what you are saying. It's an allegation, this, that. We'll see, and there will be a guide, and there will be an advisory, there will be a newsletter that will come out of that discussion. So if you check now, saying something about that may not be the best, because the data he has said, he has made his own point. Let the regulators look at it again. But the regulators have already told you that this thing is safe, that they have done a lot of review, that it is very safe. Okay, take for example where you have about 17 million vaccines deployed, that's AstraZeneca, and you are having 37 thromboembolism or issue of blood clots in only 37 instances or reports.
Now you call it only. The question is, nobody wants to be among that minute number.
Let's see now.
I mean, we're talking about life here.
No, we're talking about life. That's one in every, say, 500,000.
Who wants to be that one?
Then the point is this: we do not have evidence that this one in that 500 is even related to the vaccine, because these things happen in both people that are vaccinated and people that are unvaccinated. So what is the causal link? What is the possibility? How do you prove that even if this person didn't take this vaccine, this thing wouldn't have happened? So it happens. So the study has been done, unvaccinated, vaccinated. We are still seeing incidents of blood clotting issues in unvaccinated. So if you try to, you see that there is no causal link. But in science, we don't want to assume anything. That is why, if we are not sure, we say it is a problem. We don't want to. Scientists are not smart. They are not defensive. They accommodate everything. They are very sensitive.
So that they work by data.
When we now have any evidence to support it, we now say yes. If we do not have, we still say let's accommodate it until we strike it out.
Okay. All right. Dr. Pius Ononigwe is the representative of African Center for Disease Control here in Edo State, and we've been extracting some technicalities surrounding the vaccination exercise in Edo State. As it stands now, it has gone beyond the state level, it's at the LGA level. So when you see the group of vaccinators coming around you in your LGA, just be rest assured that they are doing the needful to make sure that they keep you healthy and help you also to fight against the COVID-19 virus. Now, what's your last message to the viewing audience?
Okay, my last message is COVID-19, just like we said, I have always said, is safe and effective and it's free. And if you are
You can read from that. The viewers they may not see it, so
okay.
just put it down and read from it.
Okay,
yeah.
so it's safe, it's effective, it is free.
Okay.
Health workers, frontliners, strategic leaders, we encourage them. They are part of the 1%. We encourage everyone to take, because by the time we take, as we are rolling out the second phase, people will say, these people we are looking up to have taken. So what are we waiting for? So I want us to understand that these conspiracy theories are not necessary for us. We are sticking on science. We are sticking on evidence-based science, so that we can take decisions, not by virtue of speculations or rumors, but by virtue of what is the reality. Okay. Thank you so much.
Thank you so much. And a word from Dr. Pius Ononigwe there, and also saying that the state government has so assured and also so ensured to make sure that the technical facilities on ground are really on top condition, so as to keep the vaccine, in good order. My name is Evan Sunohuge. We'll take a short pause now. Doctor, thank you so much for coming on the program.
Thank you so much for having me. Yeah. It's a pleasure.